What began in June as a slight uptick has become a full-blown surge in new COVID-19 cases. The CDC calls it a pandemic of the unvaccinated. And right now, Oklahoma ranks in the bottom 10 in vaccinated population percentage. The situation is most acute in the northeast part of the state. Rory Taylor explains why and what Oklahoma can do to stop the surge from migrating across the entire state.
Dr. Justin Mitchell is the chief medical officer at Integris Baptist Hospital in Miami, Oklahoma. Ottawa County is currently experiencing the highest rate of new COVID infections in the state, with numbers doubling and sometimes tripling over a week or two in neighboring rural communities.
We went a couple months there where, we just would barely have any COVID. Some days we'd have no COVID patients, or we'd have one or something like that. And then, we just started seeing one or two coming in. Slowly, numbers starting to build back up, and that sort of corresponded with what was going on in Missouri.
Over the last month, the Delta variant has spread rapidly across Missouri and is reaching out into other states, fueled by its increased rate of contagion.
Currently, I'm modeling a transmission rate to be about 2.9, which means on average, each infected person with COVID is transmitting it to 2.9 other people.
That increase in transmission rate is driving the resurgence in cases, following routes of travel. Dr. Bruce Dart is the executive director of the Tulsa Health Department.
We have a very critical hotspot in Springfield, Missouri, and Joplin, Missouri, and just following that I-44 corridor, the virus is moving westward.
But what started as a hotspot from imported cases a few weeks ago is starting to take root.
We know that once it's endemic here in Oklahoma, it's going to spread where people are, and it's hit Tulsa now. It's hitting Oklahoma City as well. So the metros are being impacted. And of course, rural Oklahoma will more than likely be next.
The highest one-day total of new cases was 6,511 back in January. And while we're not seeing anywhere near those numbers right now, as of Thursday, there were 6,678 active cases in the state.
From our small town perspective here, and our hospital's perspective, it's looking a lot more like it did in January and February so far.
Total hospitalizations in the state have tripled in the last 2 weeks, with the Delta variant targeting the unvaccinated. Many public health officials are now encouraging a return to wearing masks in public.
And if you are not vaccinated, would you please consider taking other mitigation efforts, like following the 3 W's, wearing a mask, washing your hands, and watching your distance.
Consider when you're out in public or going into an indoor facility to mask as well, because we know with Delta, there's been breakthrough cases in vaccinated individuals.
Nationwide, breakthrough cases in vaccinated people just make up 1.1% of total hospitalizations, and only 0.8% of the nation's deaths are vaccinated persons, which means that being unvaccinated has become the nation's biggest comorbidity.
Early on in the pandemic, those younger young adults and younger kids were really considered to be a low risk for illness, but now we're seeing with Delta variant that our vast majority of those in the hospital are that younger demographic that previously we weren't concerned about.
While some vaccinated Oklahomans have been infected with the Delta variant, their symptoms are less severe than people who have not received a vaccine.
The vast majority of the patients we're seeing are unvaccinated. We have seen a handful, and I think that's been the case elsewhere with Delta variant. You're still seeing your handful of patients that are vaccinated. Generally, they're doing much better.
Of those who have been recently hospitalized here at the State Department, we recognize that 90% represent Oklahomans who have not yet received their vaccine.
Dr. Donna Tungu is a pediatric infectious disease specialist and cautions that preliminary reports on the Delta variant point to an increased risk for children.
I did reach out to some of my colleagues in Arkansas just yesterday. They are seeing much higher numbers of COVID-19 hospitalizations than we were last year among children. They currently have 7 children in the ICU secondary to their COVID-19 infection. And so we hope that the Delta variant will stay a low mortality illness for children, but these rising hospitalization rates really point to evidence that this new variant will potentially be a problem for children.
Health officials say this latest COVID surge may be harder to control because of new laws enacted by the Oklahoma legislature.
The legislature in Oklahoma passed at the end of the session a law that basically forbid any educational institution in Oklahoma to require a vaccine for COVID or a mask mandate.
Because of this new law, a lot of our superintendents and school leadership's hands are tied, like they cannot break the law and mandate masks. So we really need the message to get out to parents and families that this virus is different. People have described it as COVID on steroids.
Doctors advise that whether schools require it or not, parents take eligible children to their family doctor to discuss vaccination and encourage mask usage by students. Rory Taylor, the Oklahoma News Report.